Now, almost 64,000 COVID cases have been reported here since St Patrick's Day, and so we are in the midst of another COVID resurgence. But is that cause for concern? For more on this, I'm joined by Dr. Mary Favier, who's the COVID advisor to the Irish College of General Practitioners and former member of NEFIT. Good morning to you, Mary. A big spike in numbers. Is that concerning now, or are we still okay in terms of hospitals being overwhelmed and people maybe not getting as sick with this Omicron variant?
Good morning, Ciara. It is indeed a big spike, one that was somewhat predictable, but it is very large. So I think it is a cause for concern, but I think we're likely to be okay, if we all try and do the best we can to try and support these figures. The most important thing is that the death rate is very low. People in ICU is very low, but we do have a big surge in hospital numbers, and it's putting significant pressure on the hospital services, but also in general practice in terms of, people will know anecdotally everybody has COVID at the moment. Yeah. People are not particularly sick with it, but we do need to support those who might get sick with it. So we do have to be cautious.
Okay. And do you feel, we heard Leo Varadkar say yesterday that there will not be a reintroduction of restrictions. Do you think that is reasonable? Are doctors on the ground saying, I wouldn't mind if people wore face masks more, I wouldn't mind if there was a bit more social distancing? Or do you think that it is reasonable, this idea of living with COVID, that to some extent, a bit like the flu season, we get on with it?
I think it's reasonable at the moment, but we do need to be cautious. There's a certain element of that this is a predictable wave and we have to hold our nerve. While doctors, and including ourselves in practice, we continue to wear masks, we'd like to see people wear them more potentially on the street, but it's not a small thing to reintroduce restrictions. It's a significant move to restrict people's liberty, and so you have to ask, would it be proportionate to what the cases are at the moment? And considering the very significant illness and death continue to be low, it's a nuisance of an illness for most people now, causes a lot of disruption. There are, of course, people who do need to be very careful, and we as a society need to support them by doing things like wearing masks as much as we can in public places, in crowded environments, wearing them on public transport. But in terms of making that mandatory, I think we need to continue to hold and support our health services as best we can, because we see in general practice trying to catch up with a huge backlog of work from 2 years of COVID, and that will take us a good while yet.
Okay, so are you saying that people need to be sensible as such? Wear masks maybe on like the guidelines still state that if you're on crowded public transport, you should wear a mask, or if you're in crowded indoor areas, wear a mask. Are people forgetting those guidelines conveniently, perhaps because they don't particularly enjoy them?
I think we need to be reminded of them. And for most people now, getting COVID isn't their primary concern, it's giving it to somebody else. And I think we need to be aware of that, both giving it to members of our family with wearing masks with vulnerable people, or in areas where we could pass it on. And there's a very large number of people who have COVID and don't realise it, and because they're not unwell. And so if more of us wore masks, we'd pass it on less. So it's all the vigilance, keeping our distance, washing our hands, all the things we did before, they're drummed into our skulls. But we need to actually introduce restrictions for them at this time? I think this wave will pass through. And we'll manage, but we do need to be very cautious.
And Mary, do we know how quickly you can be reinfected with it? I mean, I would have had it as part of that wave post-Christmas. I would have had it myself in January, as did thousands of people. Could I get it again now, or am I probably okay for a little bit longer, or do we know that at the moment?
We don't know. You're probably okay, but there have been cases of people being reinfected as early as 3 weeks after a previous infection. But if you're somebody who's had 3 doses of vaccine, one of which was a booster, and have had COVID, the likelihood of you getting it is very small. And then more particularly, the likelihood of you getting serious illness is really very small. And so very reassuring from that point of view. So it's very important that people hadn't had their boosters or their past 3 months of COVID infection and are due a booster, that they continue to get those, and the vaccine clinics continue to be open. Okay, so vaccination is still one of the pillars of all of this. Look, thank you very much for speaking to us this morning. A rock of sense as ever. That is Dr. Mary Favier, their COVID advisor to the Irish College of General Practitioners.